one of the biggest risk factors to having a baby or a pregnancy is actually maternal suicide. So that is one of the main causes of maternal mortality is maternal suicide.
Hmm.
And after that comes maternal hemorrhage. So it's really important that we discuss mental health when women are pregnant and once they deliver. So obstetrics is great, and it's great for delivering and taking care of women during that time. Gynecology for me was more even in residency, right? So we didn't really learn anything about sexual health in residency. We didn't learn anything about menopause. We didn't learn anything about postpartum depression. We just don't learn about these topics, even in a residency. And most recently, I was working at an academic institution, and even in that place, the residents didn't learn anything about sexual health. So it's really important that we are teaching our future doctors, but just it seems like nobody really is. When it comes to gynecology, we talk mostly about preventing disease and sexually transmitted infections and about the different cancers and things like that. But again, we just don't discuss sexual health. We don't talk about it. There was most recently there was an article in the New York Times, I think it was back in November, that mentioned about the clitoris and how half the world has it, but nobody knows about it, nobody talks about it, and just the whole function of it and the functionality and the purpose behind it. And then, of course, there was another article most recently, I think about 2 weeks ago in the New York Times, talking about menopause. And now Oprah is talking about menopause, and everybody's starting to talk about it. Michelle Obama was talking about menopause. So these are topics that we don't encounter very often. I don't know if it's just that there's a lot of taboo. I think our media and everybody's really focused on the youth and young people. And I think that's really important. I think that there's an area where we could definitely devote more attention to and more research to. And that is, as women age, what are the things that they need and how can we help them? How can we better serve them?
Yeah, beautiful. So I hear what you're saying. I have a question for you. Part of the theme of the healthy healer is this idea that communication, conversation, creativity, and specifically human connection are at the heart of all healing. Are you finding that as a woman yourself and someone who's maybe more aware, probably clearly more aware of some of the intricacies of sexual health or intricacies of the effects one way or another of menopause or of regular hormonal changes of a woman, that in your connection with your patients or your clients, that there is a surge of healing that takes place inside of that connection, even more so than the information that you provide for these people?
100%. Absolutely. I think that first and foremost, because I'm able to relate to the experiences that a woman has during this time, I think that they feel more comfortable talking about those changes. As you probably remember from med school, women go through hot flashes, night sweats, mood swings, they can have palpitations, they can have brain fog, all of those things, right? And so there's so much to it, and we just never talk about it. So definitely women feel more comfortable talking to other women that may be experiencing the same things.